when it comes to the fourth metatarsal, he ended up having surgery where they put a plate and screws over top of that. We call that open reduction internal fixation. That was done by Dr. Norman Waldrop, who is the doctor for the Alabama college football program, in addition to the New Orleans Saints. So, well qualified orthopedic surgeon. And this is a procedure that heals extremely predictably. The recurrence risk is even lower than that of a Jones fracture, which, by the way, is about 7 to 10%. So it's not that I have zero concerns for this player, but I'm just trying to say that the concerns are considerably low for him. And I felt okay taking him at 18. If you're telling me that he has the ceiling of like a Chris Jones type of interior rushing defensive tackle. But yeah, so when it comes to that fourth metatarsal, that surgery was done on March 9th. Week 12 is when I typically clear my patients for running and higher impact activities, which will be June 1st. So they're going to start doing some organized team activities at the end of May leading up into June.
Yep.
I would say don't be surprised if you don't see him actually doing field activity until training camp, and that's fine. But I do absolutely expect him to be ready to go for training camp. The only thing is that the Vikings historically do slow play injuries regardless of the player. So I'll keep an eye on that. But just speaking as a foot and ankle doctor, the bone should heal completely and he should not have any issues getting back to sport 4 to 6 months after injury, which is more than enough time to get him back for the season. I do not believe he'll be a PUP candidate.
So if you're just tuning in, School Doc Alex, he's a foot and ankle surgeon answering some questions about Caleb Banks and the foot injury update. What it sounds like is, 7 to 10% chance of, possible re-injury. That's fairly low. There's other, injuries that he could have, and that's something totally separate. Now, another question that one of the individuals that's listening in has, Norsefius, he says, Doc Caleb says he wants to play at 315-ish, down from 330. Do you think that will help a lot?
It's a good question. So when it comes to force through the foot and ankle, a lot of that force is coming down through the ankle joint. And for every pound that you lose, it's 5 pounds of force that gets removed through your ankles. So it definitely has an effect. Yes, it will help.
Mm-hmm.
However, the studies that we've done on NFL athletes that are available, and I can share those on my Twitter feed, they looked at weight in terms of recurrence risk for defensive tackles. They actually broke it up into each position: defensive tackles, linebacker, offensive lineman. They found that there was no statistical significance between the weight of a player when it came to recurrence risk of these injuries. So theoretically, physiologically, it should help losing weight, decreasing his risk of getting injured. But when it comes to force dispersion through the foot, pretend my wrist is the ankle, a lot of that force is going through the medial side of the foot, through the first ray, because that bone is larger. The rest, that's 60% of the weight just going through your big toe in the first ray. The rest of the 40% gets dispersed through the outside part of your foot, 2 through 5. And so, like, it doesn't make as big of a difference losing weight when it comes to decreasing force through that part of the foot. It actually helps more through the ankle joint itself. But yes, long story short, theoretically, it should help that he plays at a lower weight.